Good morning, everybody. How's everybody doing? Oh, you guys can do better than that. How's everybody doing today? All right, all right. That's much better. I want to be the first to welcome you guys to what we have today is a wonderful, wonderful programming. We're going to be talking about health equity, but not just health equity in action, right? And I want to be the first to speak to you guys. And actually, I want to start by thanking the folks that are responsible for putting this day together. First and foremost, the Multicultural Health Equity Collective at Pfizer, the National Caucus of Native American State Legislators, the Century Foundation, Morehouse School of Medicine, and the National Association of County and City Health Officials. Those are the sponsors, folks. You're supposed to clap for them. All right, good, good, good. All right, so a little bit about me. My name is Nate Garcia. I hail from New York City, more specifically the Bronx. You're supposed to clap for the Bronx too. There you go. All right, good, good. Now we're cooking. All right. I don't know if you guys know a lot about the Bronx, but it doesn't have the best reputation. And as a kid growing up, I always wanted to be in healthcare. I thought I was going to go the clinical route. I thought I was going to be an MD. As I grew, though, I started to be a little bit more cognizant about healthcare, right? I started to notice that all of the doctor's appointments my mom took me to were on the better side of town, more specifically in Westchester, right? I started to understand that the folks that were my friends growing up, my classmates, my neighborhood friends, they didn't have access to the same kind of care that I did. And I started to wonder why that might be. And is it just because my mom is anal retentive? No. But my mom didn't have a language barrier. We had access to a car. We had access to knowledge. We had healthcare professionals in our family. And we had champions that really, really cared about our health and were educated well enough to know the difference. When I got to high school, I think it was my 9th grade year, I took my first health class. And I started to understand, as I was in a private school in New York City, and one of only 2 people of color in my grade, that a lot of the afflictions and the chronic diseases that we were learning about, I knew somebody or somebody in my family who was afflicted with them. And I started to notice that that wasn't the case for my counterparts. And I started to put the puzzle pieces together as to why could that be, right? Why is it that me and the folks that I know and the neighborhood that I'm in and the zip code that I occupy are disproportionately affected with the diseases that I'm learning about in these classes? And when you start to think about those things, you start to put those puzzle pieces together, I think you start to realize that health equity is a thing. And now, I'm not going to tell you how old I am, but I'll tell you that health equity wasn't the topic when I was in school, right? And so as the son of immigrants, it was doctor, lawyer, engineer, right? Masters in public health wasn't on the table. But as I grew and became more literate and became more aware of the situation, I kind of naturally found myself moving towards health equity, right? Or equity in spaces in general. And so a little bit more about me. I'm educated as a biology student. I was on the pre-med track. I kind of wandered into a laboratory one day and fell in love with the bench, and then it took me a long time to get out. I'm formally trained as a vaccine scientist, hailing from Pearl River, New York. It's our Pfizer's vaccines headquarters. I've worked on all of the vaccines that have come out in the last 5 or so years, including the COVID vaccine, but more specifically, my baby's RSV. That one's actually really cool, disproportionately affects people of color, especially infants. And scientists have been working on that one since the 1950s. We were the first company to get an approval for a maternal vaccine for RSV. You clap again for that. Okay, good, good. Now you're with me, all right. A little over a year ago, I decided to join or leave the laboratory and join the CEO's office to work on an initiative, the Pfizer School of Science, where we strive to educate young students, the middle school age in New York City, and get them excited about careers in STEM. You guys are probably familiar with early talent pipelines, right? And folks that are getting the next generation of scientists and folks ready to join the workforce. I like to think of my job as like early talent pipeline, right? And more specifically, if we're looking to see change in health equity, right? You gotta make sure that the folks that are providing care and the folks that are sitting in these board seats and the folks that are leading these initiatives at pharmaceutical companies like Pfizer look like the populations they're meant to serve. Right? And so it's really important for me, at least, in my personal mission, to make sure that we are educating folks at a young age and making sure that they're aware of the possibilities of well-paying, in-demand careers that can actually make the world a healthier place for people that look like them. So I think you've heard enough about me, right? We're going to be talking a little bit about why health or diversity in the healthcare field matters, right? And I have a panel of extremely esteemed guests. And I'd like for all of you guys, if you can, to take a moment to introduce yourselves. And while you do so, I'd like to hear about the why and the motivation of how you found yourselves in the careers that you are and what keeps you motivated to keep pushing forward every day. Khama, would you mind? Testing.
Can you hear me? All right, is this good?
Good.
Good morning, everybody. I'm really thrilled to be here. My name is Khama Ennis. I am an emergency physician by training, and I come to that through being an immigrant from Jamaica as a very young child, background in education that started in medical anthropology, and a sidestep into public health during medical school because I felt like it was getting so narrow and I could only see diseases, I couldn't see people anymore. So I took a step out between my third and fourth year so I could get back the forest for the trees. And then did my training in emergency medicine and rose to the position of being the medical director and chief of a department. But when I needed to shift gears, when I needed to change my own career path and looking to hire people, I realized that I was one of only 2 Black physicians in the hospital, and that my leaving would have a much broader impact than just, needing to replace a person, a body at the bedside. So, looking to see what I could do to move towards diversity in medicine, I peeled back the layers of the onion and ended up creating a project called Faces of Medicine, which is a way to use storytelling to show people themselves in our stories. I wanted people who have never seen themselves represented at the bedside to know what is possible, and I wanted to find a way to get folks where they are, where they live, and show people who are first-generation college graduates, immigrants, people who took the MCAT 3 times before getting a score that could get them into medical school, because those aren't the stories that are told, but those are the stories that are very much out there. And I think it's part of what's going to help us increase representation in medicine and ultimately improve disparities, because we know that there's a real impact when our providers and our clinicians don't reflect the communities that we serve. And that is how I ended up here. So thank you.
Awesome. Thank you. Welcome, Khama. Monique.
Good morning. My name is Monique Miles, and I serve as a vice president at the Aspen Institute. In some ways, I may be a little bit of an interloper because while my work is not directly, squarely in the wheelhouse of healthcare, the work that I lead here in the United States supports rural, indigenous, and urban communities to redesign education and career pathways so that we are not only removing barriers to opportunity for youth and young adults of color, but we are thinking about how do we center everything that Black and brown young people need to be successful in whatever it is that they endeavor, whatever their purpose is. How do we hold race, identity, culture, community at the center of meaningfully supporting the next generation of youth and young adults of color so that they not only, again, are functioning in their purpose, but also a part of the civic fabric of our society. And my why, I think you're going to hear the same themes resonating throughout our conversation here this morning. I sit here because I am the reflection of my ancestors' dreams. I know that somebody generations before me was thinking of me, was praying for me, and was doing the work to pay it forward to create space for me. And very similar to the story that Nate told, I remember growing up Harlem, El Barrio, so out, okay. It's the sensing and feeling. You feel inequity, but you don't have the language. You feel the unfairness of the system, but you don't quite understand. And so every opportunity I received was deeply knitted in this idea of lifting as I climb. And so my why is very much about not just honoring my ancestors, but doing work that is ensuring that at least 7 generations after me will have access to the opportunities that they deserve.
Awesome. Awesome. Welcome, Monique. Peace.
Hi, everyone. My name is Peace Okpoko, and I'm the president of the Student National Medical Association at the OU College of Medicine chapter. I'm currently a second-year medical student, but kind of as Khama was alluding to, the road to get here was not easy by any means. There's a lot of barriers, setbacks, and discouragement along the way. So it was really important for me to get involved with SNMA because it's an organization that for over 60 years has been committed to not only getting Black and brown students into medicine, but making sure that we stay in medicine and thrive in medicine. So it's really important for me and the work that I do in this organization to empower middle school students, high school students, college students, to get to where I am, and for all of us to collectively impact our communities in a positive way. Thank you.
Awesome. Thank you, Peace. Welcome. Bobby, that one works.
Hey, honey, lakchi. Chante washte na pe choose upalo, Bobby Pourier machiapia, machiapalo, and Inana ate Cecilia Bicro and Bob Pourier, Iwichaki api, Oglala Lakota Hamacha, Makpia Wankantia, Lokal Change machiapi. Good morning, everyone. I shake your hands with a good heart. My name is Bobby Pourier. I come from the great and mighty warriors of the Great Plains, the Oglala Lakota. We are the people who killed Custer, only people to ever beat the United States in battle, and we're still really, really proud of that today. So I am Oglala Lakota, born, raised, and living on the Pine Ridge Indian Reservation in South Dakota. I currently am the program director of a suicide intervention program through Johns Hopkins University that does intervention work on the Fort Belknap Indian Reservation, with hope that in the future we'll expand our work onto my reservation and my home community. I'll speak about my program. Our program is called the Young Medicine Movement, and our entire ethos and the crux of our program is treating suicide intervention through giving and providing and supporting young Native students with pathways into careers that will directly address and reduce their suicide risk through improving community health. And so we do all kinds of work in the health and STEM career fields. And now we are in our third year of operation, so we have college students now. And we're supporting them all the way up through graduate school, and the work that we do, I'll speak more about it in our conversation, but it's always been really inspiring for me. Getting to my why, growing up on Pine Ridge, I always like to really heavily lean on our proud history and our warrior culture and our accomplishments, and being really proud of who I am, because unfortunately, if you've also heard of Pine Ridge, you've probably heard of our alcohol rates and intimate partner violence rates and unemployment, and you've heard a lot of these poverty statistics, and I really don't like to think of my community through a poverty mindset. And so a large part of my why was that whenever I was growing up, my mother was a researcher and my dad was a teacher, and I was constantly kind of impacted by the kind of home that they were able to provide for me. Both my parents had their issues with substance and alcohol abuse, but whenever I was born, they broke that cycle. And whenever we get back to our Indigenous communities, that's like our headline right now, is breaking those cycles. And so my parents broke a cycle for me, allowed me to grow up in a home free of substance and alcohol abuse. But that meant that I would go to school and I would be around my friends who didn't have that same privilege, who didn't have the same foundation for which they could pursue their education from. And I really felt that, and I saw it. And so from a very early age, it became my kind of lifelong commitment and goal to be able to provide the home that I had to other communities and to other families on my reservation. And so that's kind of been like my steering compass. I also like to say that everything that I do because my mom told me to. So from a very early age, she was like, you have to get your PhD and you have to go to college and become a researcher like me. And my dad was like, yeah, do that. She's smarter than I am. My big why is my mom. But really, it's for the future of our communities. And coming from a school of public health as well, you really take a perspective at a populations level. and also from like our indigenous cultural knowledge, we really know that our children are our future. And so it's all about planting seeds of trees that you won't be around for. And so our whole program is built around planting those seeds and supporting youth through career fields that'll improve their communities. Pilami HEiA, thank you.
We'll see if that's a good one.
I think so.
Oh.
It works.
Veronica,
Okay,
please.
perfect. So good morning, everyone. My name is Doctora Veronica Vital. I am the president of the National Association of Hispanic Nurses, and then I also am an assistant professor at Alverno College. So the Hispanic nurses, we've been in existence for about 50 years. We are a collective voice representing over 300,000 nurses, Hispanic nurses across the nation. We have about 50 chapters across the nation as well. And our mission is to make sure that we're promoting the health of our Hispanic communities and also promoting and advancing leadership and educational opportunities for Hispanic nurses. My why is, I'll say my why. I was a single teenage mama. So I had my son in high school. And so I was told that I wasn't going to accomplish anything after having a baby in high school. So I had to not be a statistic. So I decided to go to college. But when I was in college, I was the only one of my siblings. There's 7 of us. And so I was the only one who went to college. But while I was in college, I was the only Latina who was in my program. And so I struggled with that. I had the imposter syndrome. I felt like I wasn't smart enough, I wasn't good enough. Everybody around me looked smart, so I almost dropped out. And so I struggled with that. And so I was blessed to meet NAN. I was blessed to be introduced to NAN, and they empowered me. They took me under their wings, and they helped me through finishing my BSN, and then taught me how to be a leader. And so as a new grad, they embraced me, and I had won a scholarship from them. And they had told me when I graduated as a new graduate, they said, you're going to earn your scholarship, and you're going to be president of the local chapter. So as a new grad, I was like, I don't know how to do this. But they embraced me, they taught me, and so now my why is to pay it forward, to make sure that others have a voice, for others to feel empowered as well, and to know that we are capable and we have the capacity to excel and be leaders in our community. So we're a collective voice for our communities, and we want to make sure that we are impactful and making a difference in the health of our communities. So that was my why. So thank you. Thank you.
Incredible, incredible. All right, you guys are all feeling mighty inspired by now, I hope. All right, good, let's go. It's time to, no, all right. Setting the bar high, guys, I'll be honest with you. And so thank you so much for those intros. I feel connected to you guys in a strange way. I know we only met today, but I feel that given our whys and given the work that we choose to do, right, and the mission that we share, there's a lot that we give of ourselves, right, and all too often I think there are a lot of obstacles in the work that we do. And so I'm very interested to hear your perspectives on a couple of other things we're going to talk about in this conversation. First being, though, how do you guys feel, and through your perspective and maybe through the lens of your respective industries, having a diverse workforce may impact the health outcomes of minoritized communities? Please, yeah.
So I think the impact of having a diverse workforce cannot be underestimated. There are data that show that infant mortality can be reduced. The disparity in Black and white infant mortality can be reduced by 50% if there's a Black pediatrician involved. There are data that show that life expectancy for minoritized communities improves when there's diversity in the primary care workforce. There are data, so it's irrefutable. It's not a photo op. It's not, a statement that gets written somewhere. It has a real life and death impact, and I think there are very few measures that can have that level of impact on real people and real families and reduce suffering in the way that we need it to happen. And I think it also, having a diverse workforce allows people who are minoritized to see themselves in these spaces, to see what is possible, to know that there is a seat at the table for them, for us, and that this is our space as much as it is anybody else's.
I would add to that just a few things. The first is that if we truly are able to achieve a vision of a diverse workforce, it means a couple of things are true. It means that youth and young adults of color have access to education and career pathways, which is another way of saying that they have means to achieve economic and social mobility. So that is just really important. We're talking about supporting young people to thrive. The second thing is that particularly for every youth and young adult of color, we know that every time a young person, this is my story, we heard everybody and their why share a similar story, every time a young person achieves a secondary credential, a post-secondary credential, meaningful connection to career pathways, that has a generational ripple. They come back home and they start speaking differently to their parents. They start speaking differently to their children. I mean, we heard people here tell us stories about what it meant for someone close to them to achieve this type of goal. So we also know that there's a generational impact, a generational ripple that we cannot measure, but it's critical to the health and well-being of our society. The next thing that I want to say that we also heard echo in our stories is it's especially important because people of color serve as translators. When young people are able to participate in a diverse workforce and a diverse economy, what they are doing is taking some of the science that we heard people speaking to and helping their parents understand what that means, helping their cousins and their peers understand what that means. It's access to information that they can leverage for their own purpose. It opens the door, it widens it in ways that allow future generations to come through. And then there's this other piece that's so important. Having a diverse workforce is how we get to the promise of our democracy. The promise of a multiracial democracy that works for everyone is part and parcel of being able to have young people meaningfully participate in the workforce and having it reflect them in ways that help us get to a much more inclusive democracy, because what we're talking about is not just agency, but we're talking about self-determination in ways that help our communities, in ways that help young people to thrive, in ways that help families.
So with me, I echo everything my colleagues have just said. Just to add a little bit of perspective when it comes to diversifying the workforce, just to kind of give you a perspective on that. With the Latino community, as you know, probably the statistics, we represent approximately 19% of the nation's population. And unfortunately, we only represent less than 7% of RNs out there across the nation. So the workforce is not diversified. Same with the Black Nurses Association, Black nurses as well. They're about 6.5% nationally as well, representing the nurses out there. And they represent approximately 13% of the nation as well. So you see the disparity in the workforce out there. And so as my colleagues mentioned, when we are cared for, statistics show that when patients are cared for by somebody who mirrors them, who looks like them, usually there are better outcomes. There are greater satisfaction with care. And so we really want to strive to diversify the workforce. And then for the statistics, when I started back in 97, 98 in nursing, the Hispanics only represented 3.6% of the nursing workforce, and we're only at almost 7%. So we haven't advanced too much in 26 years. So making sure that our colleagues who are not of color or represent the communities that they service are trained in cultural competency and cultural humility. And so that's important for our community. So making sure that if we aren't able to diversify that workforce quickly, at least make sure they're able to provide that adequate care for our communities. So thank you.
Excellent. Bobby, did you want to add?
Yeah. Thinking about how a diverse workforce has an impact on health outcomes, I think the biggest thing would be treatment-seeking behavior. For me, two things especially. I think the first is to acknowledge centuries-long hurt and scars that not having a diverse workforce in the medical community has placed on communities of color and how they experience healthcare. Thinking about things like Henrietta Lacks and the Tuskegee experiment, and even all the way up until the 80s and 90s in the Indian Health Service, forced unconsented sterilizations. And that really impacts people's willingness to go to a hospital to receive care. And the other thing, some personal experience that I'm dealing with right now, I turned 27 the other day, and somebody told my wisdom teeth, and my wisdom teeth are coming up right now, and I don't get home for a while. And on Pine Ridge we do have a native dentist, and I don't really trust any other dentist to work on my teeth. So I'm excited to get home because in our dentist we do have some representation, and I can't wait to see her. So our diverse workforce matters a lot.
Of course. Happy belated.
Thank you.
And I do want to just underline, right, like cultural connectedness can't be overstated, right? The ability to walk into a doctor's office and to see somebody that is of your culture and shares that connectedness with you, certain things you just don't have to explain, right? And then when you think about advocacy and you think about folks in positions that are making decisions that will impact health outcomes, every seat at the table needs to be cognizant of every decision that they make and how those decisions might impact people that don't look like them. And so I think all too often as humans, we are impacted by our implicit bias, and that maybe sometimes narrows our focus. But if you have the right folks at the table, then those biases are no longer prevalent, right? And so we start to think about those things. And Monique, did you want to jump in?
Well, I just wanted to connect a dot, Nate, between what you shared and what Bobby shared, because we so often talk about history like it's in the past. Mm-hmm. But history is present because it has shaped the very systems that we are required to navigate. So when you bring up Henrietta Lacks or the Tuskegee experiment, mm-hmm. that has a real resonance with how Black people show up in the healthcare system currently. So I just want to name that. It matters that representation matters because you can't be what you can't see. Representation matters because it means when you speak, you are understood in all of your culture and community. By the way, it's not just what you say, it's also what you don't say
right.
that is understood. But then the third reason is because history is so present. People of color understand that. They know that history, and they understand how present it is in ways that can help ensure communities of color get access to the services they deserve.
Yeah. And as you mentioned, access, right? And I think about the systems that are in place and policies and folks that are making, governmental decisions that impact us, like redlining, right? And we can go down, we can get into the weeds, but I do want to stay a little bit on track here. And so when we're thinking about creating a diverse workforce, I know there were certain hurdles that I had to overcome. I'm wondering if you guys know of any initiatives or any pathways that might be of use to somebody that's looking to get into the workforce or the healthcare field specifically.
Right. Hi. Well, for those of us in Oklahoma City, I definitely could plug Club Scrubs It's a program put on by OU College of Medicine. They have sessions during the summer and during the school year where they have like several events to get high school students interested in STEM, interested in medicine. And then another organization would be the Youth Medical Mentorship. It originally started in Tulsa, but they just recently started a chapter here in Oklahoma City. And every month we go to various schools. Actually, this week we went to Santa Fe South Middle School, and we work to like do different activities in various healthcare fields to get that exposure early.
Excellent.
So my recommendation would be to research the professional organizations that are available. For instance, NON, I'll put a plug in for NON, the Hispanic nurses. We are an organization that does a lot of mentoring. We mentor our students. We go out into the community. As I mentioned, we have 50 chapters across the nation, and all of our chapters go into schools and mentor our youth, provide that empowerment and encouragement to seek a career in the healthcare profession, even if it's not nursing. But the other thing I would recommend, and the other organizations, there's the Black Nurses Association, Filipino Nurses Association, the Student Nurses Association. So there's so many organizations that you can be a part of. And as a youth and students, I recommend that because you look for mentors. You look for somebody who can mentor you. And as I mentioned, when I got involved as a student with NON, I had a mentor from the local chapter, and today, 26 years later, she is still my mentor, and we still have phone calls like almost at least once a month, and so we keep in contact. She's been amazing. She's been a big support, but there are mentorship opportunities, scholarship opportunities, and then this also helps you with your resumes, so it makes your resumes shine, so it helps with getting jobs and stuff as well. So that would be my recommendation, is looking for the different professional organizations that are available to you.
And I'll just add to that, the National Medical Association, which hopefully most folks know about. If you don't, it's what Black physicians started in the early 20th century when the AMA wouldn't allow us to be part of it. And in addition to the national organization, there's the Student National Medical Association that I was active in as a med student, where Peace is her local chapter president. And there are also MAPS chapters in undergraduate spaces. So those are all places where people can tap in, gain access. And I also want to encourage folks, don't be afraid of a cold call, right? Like, if you look up your local hospital, if you look up a local medical practice, don't be afraid of a cold call, because the worst that somebody can say is, no, I don't have time right now. The best they could say is, absolutely, why don't we set up a time to connect? Why don't we set up a time for lunch and let me see who else I can connect you with, because it works. So just don't be afraid of that, because I didn't have anybody in my family who was in medicine. I didn't have people that I could tap into. There was no network, so there was a lot of just showing up and saying, hi, I'm Khama, can you help me out? And some people said yes, some said no, but don't be afraid of it.
No, that's excellent advice. You guys would be surprised how many messages I get on LinkedIn from folks that are just interested in learning about Pfizer and or vaccine science and or with no connections, mind you, right? And the worst that could happen is actually just you're in the same position you started, right? But definitely keep trying, right? And make use of all of the resources that you have available, right? Google is incredible, right? AI is even more powerful. So you guys have the ability to do some of the research and find these professional organizations, right? I do want to be cognizant of time, and I want to open up the floor for questions to the audience in just a moment. But I know I mentioned barriers and obstacles that we've all faced in getting to where we are in our careers and the path that we've chosen. I'm wondering if you guys might be able to highlight some barriers that you've faced and some advice for overcoming them.
Okay, here we go. One that I can immediately think of is just the general implicit biases that people have, especially in schools where they're supposed to be supporting every single student, but that's not always the case. I remember my freshman year of college at Duke. I was going through personal stuff with my family, and so I was struggling in my organic chemistry class. And I remember talking with my advisor that semester, and she actually told me that I should consider deviating from pursuing medicine and look into another career path. And so I was very disappointed with that conversation, but if not for my fellow Black pre-med peers to encourage me, I would have listened to her and I would have given up and I wouldn't have been where I am today. So it's very important to keep going. It is a difficult journey, but if you keep going, and especially finding that support around you to keep encouraging you and mentors that are where you want to be, it's not unattainable at all.
Agreed.
So real quick with some of the barriers for myself, I encountered, again, being one of the only children in my family to go to college. So I didn't know how to navigate college. I was overwhelmed. I didn't know how to do this. I really was gonna quit school. So again, the mentorship, finding mentors, having somebody guide me through that and encouraging me and empowering me. And then the imposter syndrome as well. It's like not feeling smart enough, not feeling like I belonged, being engaged with individuals who represented what I believed in, looked like me as well. That also empowered me to continue on and to show that I do belong and that we can get educated as well. So, and that we have that voice for our communities. So, thank you.
So a big barrier, we talk about access and resources. We, in communities of color, we can have a whole conversation about resource extraction and the withholding of resources. We were talking about redlining a little bit already. And growing up on Pine Ridge, I was an Our Lady of Lord Brave, Pine Ridge Thorpe in kindergarten, and then a Red Cloud Crusader. All reservation schools on the reservation, most of my teachers were volunteers or community elders. And the biggest, hardest thing was kind of like having a lack of role models or a lack of people before me that broke through the ceiling and showed me the path. From my reservation schools, with the support of my people in my community, even those that hadn't done things. I went from Red Cloud Indian School on to Yale University, and then eventually to Johns Hopkins. And so I wouldn't have been able to do that if I didn't find the role models that I have. And I don't know if she's watching or anything, but I really want to give a shout out to the biggest role model in my life, Dr. Teresa Brockie, who is at the School of Nursing in Fort Belknap, Aani tribal member. And so my biggest thing is always find a role model, reach out to role models, latch onto them like a like a barnacle on a turtle or something, and they'll carry you. They'll bring you up with you. Bring you up with them, especially role models that look like you and have experienced the same things that you have.
I'll just add a couple of things quickly from a barrier perspective. I think a lot of what our work is also around demystifying pathways. It's not just, access to college or access into professional training school, medical school, dentistry, et cetera, but having a keen sense of what you do when and how you do it. And the idea that you could scaffold or stack your credentials or your learning in ways that help you continue to achieve throughout your career. I think especially for young people of color who you do not have members of your family, you do not have close friends that have been able to navigate these professional pathways, I think having someone to help you understand, first you do this, and then you do this, and then consider this, but don't forget about these things, is really important. And another way to say that is demystifying pathways. The second thing, particularly for first generation anything, you need stabilization supports. What do I mean by stabilization supports? Your car breaks down. You have a child care emergency. You need to get home to get your wisdom teeth pulled out. You need to have access to resources that help you fill the gap between whatever your needs are and continuing to stay on your studies, continuing to stay on your path. And it's incumbent upon any institution or system that is inviting young people of color to achieve a degree, to access a career opportunity, to make sure that they have access to stabilization supports that get them to and through each opportunity. And then the last thing that I want to say that's been implied here, but I just want to name it. Not only does your community matters, but your source of nourishment matters. We just heard Peace tell us this story about having this moment, and depending on how you were raised, depending on your relationship with power and formal authority, if you have a figure tell you that you can't be or you can't do, you may internalize that differently. So your source of nourishment matters, especially as you are navigating barriers and challenges, because we know that they're going to come, and they're going to uniquely come for people of color. So your community, your people, your posse, your nourishment matters.
Yeah.
And I echo and agree with everything that's been said. And I want to add that I think one of my personal barriers was that I didn't know what I didn't know.
There you go.
And being able to figure that out still is a challenge, right? I'm still figuring my way out through all of these different spaces. And the culture of medicine is one where admitting that you don't know something is really not an option. But getting through and over that, I think, is a really important way to get to this part of the table, to become a physician, to become a nurse, to become a clinician, to do whatever your role is in healthcare. So I think being able to say, I don't know, knowing that the person that you ask might not know, but the next question is, well, who do you know that might? Mm-hmm. And knowing that it may be a couple of steps removed from that first person that you contacted, but somebody somewhere has the answer. And so being persistent in that and getting out of your own way, like in my personal upbringing, it's like you don't ask for help, you handle your business, but that is not a way that anybody has ever truly accomplished anything. We all work in support of each other. We all are on the shoulders of those who came before us. And so if we don't lean into the opportunities that are there, to the resources that are there, the only one who's suffering is you, right? And the communities that you could be serving if you pushed yourself further, if you made yourself a little uncomfortable in that ask to get to what you need.
I tell you guys, I'm feeling fired up. I want to get to work. I do want to highlight really quickly just one thing. Beware of gatekeepers, and do your best to make sure you're not the one gatekeeping. You're going to find your people are going to find you. I can't tell you how important community, how important a source of nourishment, how important having folks in your corner to tell you that you're incredible, even when you're questioning yourself, right? When I was approached to moderate this panel, I said, me? Right? But here I am, right? And wearing my sneakers with my top knot and having a great time. Make sure that you have people in your corner that recognize how incredible you are and don't hesitate to tell you at every turn, all right? Because there are going to be times you wake up in the mirror and you're trying to give yourself that pep talk and it's just not hitting that way that it needs to that day, right? And coffee's just not doing it. If you have folks that are around you that genuinely care and genuinely love you for you, that journey becomes a lot easier, right? Putting one foot in front of the other becomes a lot easier. We do have a handful of minutes. I do want to invite you guys to come and ask some questions if you have something specific. I could stay here and chat all day. Yeah. The mic is in the front, but if you... Oh, turn it on.
So thank you so much for all those insights. As we have students here in the audience, I'm curious about, I'm going to get away from you. What have you always been good at when you think about what you need to bring to the table to do your job today? And what is the one thing you learned recently as far as a skill set that you needed to do your job effectively? What have you always been good at, and what have you learned recently?
I'll be super quick. I've always been good at puzzles. That's kind of my thing. And I've never been good at asking for help. And I have learned that in abundance over this last few years, because there's no way I would have been able to do what I've done the last few years without asking for help, without reaching out. And I'm still learning.
Something that I've always been good at that I think it has led to my success is my ability to build community, and particularly my ability to build community in non-traditional spaces. So being able to find people who look like me and figure out how do we show up in mutuality and solidarity with each other, because we about to get through this together. And so I think that is a skill that has helped me in life. And I think that what I am working on is the power of delegation. I don't have to do all the things. So everybody can, the proverb I think is many hands make light work. So we will all have light work once we are all participating.
For me, something I've always been good at is my organization skills, which is very helpful with school and extracurriculars, research, etc. Something that I'm still learning how to be better at is my networking skills. I'm an introvert at heart, but building that network, as we've heard today, is very important for getting you far in life.
What I've always been really, really good at, and it's a blessing and a curse, is I am super stubborn and very hard-headed, and nobody could ever really tell me not to do something. I'm sitting up here, I'm in a lot of pain with my wisdom tooth. And I'm still sitting up here. But I think that's really protected me in a lot of ways. And being like really comfortable being alone and doing something, I think that stubbornness really helps me out with that. A thing that I need to improve on is that willing to divide up some of the work is probably helpful. But I think a real point of improvement would be being more communicative with that, but also like answering emails and texts. I see Yartish up there and our support staff. I know that they've probably felt that. Slow to respond to emails and stuff. But yeah, so stubbornness and probably some communication skills.
Excellent. Veronica, last but not least.
And with me, I would say communication and having interpersonal skills has always been one of my positive traits. One of the things that I need to work on is being able to amplify my voice. Even though I've had those personal communication and those relationships, I've always been more timid. And now representing a platform nationally is being able to amplify my voice and being heard. And so that's something that I need to work on, as well as the other skills here that they talked about, because the delegation, it's so hard because we just want to get it done, right? And so being able to delegate it and trust that our team is doing the job that they need to do. And so that is another thing that I'm working on. So thank you.
Agreed. Can I add real quick? I know this is our cue. We got to get the heck out of here. I think I've always been good at making work fun. I think that if you are having a challenging time, but if you're still having fun, that's where you need to be. And what I'm still working on getting better at is refilling the tank, making sure that I'm taking time to put back into me what I give so readily to everybody else. And so I find myself having a few more bubble baths every once in a while, a nice cup of tea before bed. And on that note, now that you know how I bathe, I want to give a huge round of applause to our guests here. Thank you guys so much. Such incredible insights.